Hi, I'm Dr. Chase Hayden from the Hayden Institute. You can find out more about us at www.haydeninstitute.com, wherein you can find more about our information from Twitter, Facebook, other YouTube videos, our blog posts, and just general information about our offices and what we do to help our patients. I'm a licensed chiropractor in the state of Texas, but predominantly I help my patients through neurological and nutritional rehabilitation. So when I see patients, apart from looking at them structurally, like most chiropractors do, I also look to see what's going on nutritionally inside of their bodies. We run blood tests, we run urine analysis, stool samples, and we try and take a supportive approach with our patients through nutritional means. So today we're going to talk about cholesterol. In fact, just this morning I received a Facebook message that says, "How can you lower your cholesterol naturally?" So that's a common topic. What can we do with high cholesterol? How can we support it? Because not everybody wants to be on a statin drug like Lipitor or Crestor. Those are very efficient ways for lowering cholesterol, but they do have side effects. They can cause other concerns in people's lives, such as joint pain and full body stiffness. They can also deplete CoQ10, which is a nutrient for your heart health. And without, of course, diet and exercise, as recommended on the commercials, it may not be the best thing for everyone. So when I have patients that come in and ask about cholesterol, we take a very broad spectrum nutritional support program for them and try and help them out to the best of their ability. And we like to do pre and post checks with their blood work. Generally speaking, there are three main things you can do to help decrease your cholesterol that you can start doing today. So let's write those down. For those of you that have seen other videos of mine, I've got a larger marker by request, so hopefully you'll be able to read it. So number one, decrease food allergies. So food allergens, or food sensitivities is what they're better known as in our office, because they are different. A food allergy would be something like someone who has a peanut allergy and gets anaphylaxia and possibly dies from peanuts. That's not what we're talking about. We're talking about food sensitivities. Food sensitivities create a reaction in your body, but may not be detrimental or life-threatening upon consumption. So sometimes these are things like gluten, or casein, or soy, or corn, or other common food sensitivities that some patients have. The number one thing you can do to decrease your cholesterol is remove food sensitivities from your diet. Now, if you're not sure which food sensitivities you are, or you currently have, an elimination diet is a great way to start. Just try and find out for yourself. Avoid gluten 100% for 3 weeks and just see what happens. If you lose some weight, if you stop having your headaches, if your sleep improves, etc., and then when you re-add it back in after 3 weeks and all those symptoms start coming back, that's probably a food sensitivity for you. But you can also use your blood type to try and figure it out. So as you'll see on this chart here, certain foods are more common as food sensitivities than others, depending on your blood type. So for example, if you're an O blood type and you have high cholesterol, or you want to lose some weight, or you have some hormonal stress, a great thing to do would just start by eliminating these food sensitivities. And you'll see that O blood types are most sensitive to things like gluten and casein. Gluten found in wheat, barley, rye, and cross-contaminated oats, and casein found in dairy products. And as you can see on this chart, there are different foods for different blood types, and these are the top 10 or so. The second most important thing that you can do to lower your blood cholesterol is avoid sugar. Sugar in any form, any carbohydrate, is going to allow your body to start having irritation and inflammation. So as you're avoiding your food sensitivities and avoiding gluten or corn, which are grains, that's also going to help you to avoid your sugars. But that's not it. Diet Coke, even though it's an artificial sugar, artificial sweetener, that's not the same as refined sugar, still affects your cholesterol. Other sugar products, such as, of course, other regular Cokes or refined sugars, are going to affect your cholesterol. And even things like starches, such as rice and potatoes. If all you eat are potatoes and sausage every single night and you have high cholesterol, try eliminating the potatoes and see what happens. Because sugar irritates the lining of the blood vessels. When we think about it in everyday life, if we cut ourselves on the outside of our hand, the blood comes and reacts with oxygen and begins to clot in most people, and we start having a healing effect that takes place. Well, when we consume large amounts of sugars and sugars go into the bloodstream, they create little abrasions and little nicks into the blood vessels on the inside. Your body cannot start clotting those blood vessels like it can on the outside of the body, because then the whole insides of your body would start clotting as a chain reaction. So your body has to use something different to regulate the little abrasions that are going on inside your blood vessels. And our body intelligently uses cholesterol, a fatty substance that can bind to the lining of the vessels and therefore start protecting us. Well, when we take too many sugars into our diet, and we already have inflammation from these food sensitivities, it makes it harder for our body to be able to repair the damage to those areas. So your body puts more cholesterol out, and more and more and more. And eventually you show up with a blood test that has cholesterol around the 300s. And we don't want that. So we decrease our inflammation, we remove our sugars, and third, last but not least, we begin to exercise. So exercise is a very efficient way to start lowering your blood pressure, your blood cholesterol naturally. Just 30 minutes a day of walking will do leaps and bounds of improvement with your cholesterol, because it starts stimulating metabolism processes in your body, and it starts detoxifying and really just helps your internal system. So the 3 top things you can do to start lowering your cholesterol today are: decrease your food sensitivities, just like we talked about on the chart. Avoid sugars of all forms, whether it's artificial sweeteners or refined sugars, or even starches like rice and potatoes. And exercise. 30 minutes a day, starting now. Now, a lot of people look at me in our office whenever we ask them to do that, and they freak out. They go through culture shock and they say, "What am I going to eat, Dr. Chase? You've already taken away everything grain related with, bread and pasta. You're now asking me to get rid of rice and potatoes with starches. I can't have my Cokes anymore. You're not letting me have cheese or dairy products. There's nothing left." Well, this isn't a death sentence. This is to help you change your life. If everything you were already doing up until this point was perfectly fine, you probably wouldn't have high cholesterol. So we're asking for slight modifications to the way you're currently consuming your food. And as we see changes on your blood work, we start reintroducing these foods again. I'm not saying that dairy is the root of all evils. But for some people, if it's a sensitive food and it causes inflammation, it's contributing to your symptoms. Whether it's high cholesterol, or your weight gain, or your infertility, or your seizures, or whatever's going on, if it's creating that inflammation and your body's not able to keep up with it, it could be a trigger that we need to take care of. So, by starting out with these 3 simple steps, we can have dramatic changes in your cholesterol. And so, as you'll start seeing on these papers that we're looking at, this first patient was not a patient of ours in our office, but he is my father. So my father in the year 2000 went and saw a mentor of mine that took his blood work, put him on a very similar program as we have just witnessed, avoiding food sensitivities, avoiding sugars, and brisk, gentle exercise. And on November 13th, 2000, as you can see, his triglycerides were 477, his total cholesterol was 256, his good cholesterol was 31, and his bad cholesterol was not able to be calculated because of how bad his triglycerides were. When you look at his cholesterol to HDL ratio, which is the ratio that is used to determine your susceptibility to heart disease, it was 8.26. Now, after about 3 weeks of him avoiding food sensitivities, avoiding sugar, and beginning gentle exercise, we now see that on December 9th, his triglycerides had dropped to 159. His total cholesterol was 165. His good cholesterol was 29. His bad cholesterol was 104. And his risk of heart disease also dropped to 5.69. Now that's a staggering improvement in his cholesterol levels without the use of statins, without the use of Crestor or Lipitor or whatnot. And that was 10 years ago, and I use that example because my father was able to change his cholesterol just by changing his diet. And it's allowed him to live longer, have a healthier life, and be where we are today, 10, 11 years later. But let's look at some patients from my office specifically. This woman here is a 71-year-old lady. This blood test, whenever we look at her cholesterol, her total cholesterol was 270. Her good cholesterol was 60. Her triglycerides were 117. Her bad cholesterol was 187. And her cholesterol ratios were 4.5. After 17 days of following this program, we see that her total cholesterol dropped to 245, which was a 25-point improvement. Her good cholesterol went up 5 points to 65. Her triglycerides dropped 57 points. Her bad cholesterol improved 19 points. And her cholesterol ratios dropped 0.8 points, or almost 1 full point. That was just in 17 days for a 71-year-old woman who was willing to change her diet because she didn't like her high cholesterol. Now, it's still elevated, that's true. But she's a 71-year-old woman that had a huge change in her health just by changing her life and her diet. Another patient that we have here is a 62-year-old woman. This is a longer period of time. So we originally did this blood work on October 29th, 2010, and then we got the results back just earlier this month on February 17th, 2011. But when we look at her cholesterol, it went from 259 to 227. Her triglycerides went from 76 to 58. Her HDL cholesterol, her good cholesterol, went from 50 to 65, so an increase in 15 points of the good cholesterol. And her LDL cholesterol, or her bad cholesterol, went from 194 to 150, an improvement of 44 points. So as you can see, patients, you guys have the ability to change your cholesterol by changing your diet. And as your cholesterol starts to improve, you will no longer have to stay on these restrictions. So that's what we do in our office for patients with high cholesterol. And now we don't want our cholesterol to be too low either. Cholesterol is not a bad thing per se. It's just the body's natural reaction to injury. So if we're inflamed, if we're tearing up the inside lining of our blood vessels, we need cholesterol to come in and patch up the area. But we also need cholesterol for hormone production. So in some of my patients, when the cholesterol is too low, we also see an issue. So I like to keep my patients to have their blood cholesterol between 150 and 200, and anything below below 150 can potentially be a hormonal issue to where they're not able to create hormones and they're having infertility issues or menopausal issues, or even for some boys they'll start having blacking out or seizure activity because their hormones are disrupted and now it's starting to create a neurologic effect in their body. So cholesterol is not necessarily bad because it's the body's natural response to injury, but it's not necessarily good either, and we should always listen to our body as it's telling us what's going on from a symptomatic standpoint. So for those of you that were wondering how you can lower your high cholesterol naturally, you now have 3 easy steps to start incorporating into your life. Of course, if you're on a statin drug or you have other health concerns, always talk to your doctor first, because you don't want to do anything crazy, such as removing food sensitivities or avoiding sugar or starting an exercise program without someone else knowing about it. I'm Dr. Chase Hayden from the Hayden Institute. Once again, find out more about us at www.haydeninstitute.com. That's www.haydeninstitute.com. Have a great day.